As leaders of zygomatic implant placement, one of the questions we often get asked is, what's the success rate of implant-supported dentures? Various studies show that the overall survival rates of implant-supported dentures stand at around 96.8%. Therefore, roughly 96 out of every 100 cases will have a trouble-free experience, one that provides optimal aesthetics, stability, and first-class hygienic maintenance for those who undergo the treatment. The most common causes of fixed denture failure with zygomatic implants are sinusitis, oral fistulas, and soft tissue complications. However, with the zygomatic anatomy-guided approach, ZAGA, steps ensure that potential problems are minimalized and even eradicated. Instead of adopting a particular treatment type for every patient, the ZAGA approach changes its tools and processes to adapt to each patient's anatomy. So, why is this important? Each patient who comes in for treatment has a different facial anatomy. This is because they are at varying stages of bone resorption due to tooth loss. Therefore, what works as an implant placement for one person might not be as successful for another. On the contrary, when you adapt the ZAGA techniques, zygomatic implant placement, and the ZAGA tools, round or flat zygomatic implants, to fit each patient's anatomy, the risks of sinusitis, soft tissue complications, or oral fistulas are significantly reduced. We are of the philosophy that it is far easier to prevent complications than treat them, so the ZAGA approach is geared towards doing precisely that. In addition, the ability of zygomatic implants to support a fixed prosthesis is also high. A 10-year follow-up study, the first of its kind, showed promising results, making it a calculated procedure with predictable long-term outcomes. This study was then used as the grounds for the ZAGA anatomy-guided approach that we readily use today. With the ZAGA approach, the patient receives individualized treatment. The zygomatic implant is placed via a minimally invasive treatment, always with protection of the sinus wall in mind. Using this approach, more bone is conserved in the critical areas. The membrane of the sinus wall is preserved, and the soft tissue around the implant head remains healthy. The correct implant creates the ideal seal, so there is less chance of bacteria entering. Ultimately, the ZAGA method reduces the chances of infection to almost zero. So, to recap, the success rate for zygomatic implant-supported fixed dentures is around 96.8%. So, it is a safe and stable procedure. However, problems associated with zygomatic implants in general include sinus and soft tissue complications. The zygomatic anatomy-guided approach, ZAGA, is a culmination of various methods that adapt to the patient's anatomy rather than forcing a one-size-fits-all treatment on the patient. In doing so, surgery is minimally invasive and many of the bone-critical areas are preserved, as is the sinus lining. The correctly selected ZAGA round or flat implant also provides the ideal seal to prevent bacteria from getting in. Ultimately, the ZAGA approach reduces the chance of implant site infection and complications to almost zero, while boosting implant survival rates to near 100%.